Hi everyone, it's Dr. Daniel Careaga of Careaga Plastic Surgery. I am a double board certified plastic surgeon in Coral Gables, Florida. Today, we're going to talk about the arms, and specifically what about the arms? We're going to talk about arm contouring. So what are the options, okay? So really, it all depends on what is the problem. So it's usually one of two things, if not both. Usually there's an excess amount of fat, or there can be an excess amount of skin, or there can be both. So the treatments is going to depend on what is the underlying problem. So for instance, somebody that has good skin, that has been a little bit overweight and that has some fat deposits in the arms are usually an excellent candidate for arm liposuction. Now, arm liposuction is a very quick and very well-tolerated procedure under local anesthesia. A small incision is made about 3 millimeters by the elbow and a second one by the axilla, by the armpit. And numbing medicine is used to anesthetize the area to really make that procedure be very comfortable. And then liposuction is performed. They insert a small cannula, an instrument that removes fat through those incisions, and I'm able to contour the arm and give a really nice shape to it, so removing those excess fat deposits. Now, many times there will be a little bit of loose skin. The skin of the arm is a lot thinner than other parts of our body. So a lot of times you can tell that when you touch it, it feels a little flabby. The skin doesn't quite feel tight. So in those milder cases of loose skin, I add a skin tightening procedure called J-plasma. This is an energy-based device. So through the same incisions that I do liposuction, I insert the J-plasma device. That transfers energy to the undersurface of the skin, and that causes the skin to shrink down. So we can get a better, tighter result than I can with standard liposuction. Now, in patients who have lost significant amount of weight, whether through diet, through Ozempic, or through surgery, there could be a fairly severe amount of loose skin. At that point, I use a combination of liposuction with what is called a brachioplasty. A brachioplasty is the term for an arm lift. And there are several options. So the standard brachioplasty is an incision that goes from the elbow to the axilla. Now, a lot of people rightfully have concerns about the scar. So what do we do to hide the scar? I place the scar on the inside part of the arm so that when the arm is by your side, you don't see it. You don't see it from the front and you don't see it from the back. Usually this arm skin scars very well, so you end up with a thin white line just up and down the arm. I combine this with liposuction to contour, and then I remove the extra skin through the arm lift. Now, in severe cases where the excess skin extends onto the chest wall, we can actually take that incision and extend it onto the chest, what is called an L-plasty. And that is for patients on average who have lost over 100, 150 pounds, and they just have a severe amount of loose skin, too much to remove just from the arm. So we actually extend it onto the chest wall and remove. So this is one of the many body contouring procedures that we do commonly here as part of body contouring in patients who have had massive weight loss, whether through diet or through surgery. So the recovery is quick. It's about a week recovery. I don't usually leave drains in my arm lifts. There will be swelling, of course, for several weeks, and I have my patients wear compression garments for 2 months. They're sleeves that cover the arms and just help that swelling go down faster.